Let me ask you something. Have you ever felt completely fine, only to hear from your doctor that your blood pressure is high? No pain, no dizziness, no warning. That's why hypertension is called the silent killer. Right now, more than 1 billion people worldwide live with it. And here's the scary part. Half of them don't even know. It hides quietly, building damage inside the body year after year. So what is blood pressure? It's simply the force of blood pushing against your artery walls as your heart pumps. When pressure is normal, your arteries can handle it. They expand, they contract, they stay flexible. But when pressure stays high, day after day, year after year, those arteries start to change. They get stiff. Tiny tears form. Cholesterol slips in. And over time, this leads to heart attack, stroke, kidney problems, even vision loss. Now, you might wonder, why does it happen? The truth is, there isn't just one reason. Sometimes it runs in families, but most of the time, lifestyle makes it worse. Too much salt from processed foods. Not enough potassium from fresh fruits and vegetables. Carrying extra weight. Not moving enough. Stress that never lets go. All these things force your heart to push harder, and slowly, pressure rises. Other hidden factors add to the risk. Diabetes, sleep apnea, smoking, drinking too much alcohol, and simply getting older because blood vessels stiffen with age. Now here's the dangerous part. Most people feel nothing in the early stages. You could be walking around with blood pressure in the 150s or 160s and feel completely fine. No clear warning. And when symptoms do show up, they are vague. Maybe headaches, dizziness, blurred vision, or feeling tired. Too easy to ignore. That's why doctors keep reminding you, check your blood pressure. It isn't paranoia. It's prevention. But here's the good news. High blood pressure is not destiny. It can be controlled. In fact, research shows that lifestyle changes, the right foods, daily movement, stress control, can lower blood pressure as much as some medications. And if you already take medicine, these habits make your treatment work even better. So in this video, we're going step by step. First, the foods you should avoid. Then, the foods that actually improve circulation and lower blood pressure, proven in clinical studies. We'll also cover lifestyle and diet changes that make the biggest impact. And finally, the best cardiac exercises, how they boost blood flow, which hormones they release, and why they protect your heart. By the end, you'll have a clear picture. Not just what to do, but why it works. And most important, how you can start protecting your heart and your future today. Action! Before we dive deeper, don't forget to like this video, subscribe to the channel, and share it with a friend who needs this knowledge. Your one click helps this life-saving message reach more people. When we talk about controlling hypertension, people often ask, which foods should I eat? But an equally important question is, which foods should I avoid? Because some foods don't just raise blood pressure for a few hours. They set the stage for long-term damage inside your arteries. Let's walk through the biggest culprits. Processed and packaged foods high in sodium. Chips, instant noodles, canned soups, frozen pizzas, and fast food meals all are loaded with hidden salt. Excess sodium pulls water into the bloodstream, increasing volume and pressure, but it doesn't stop there. High sodium damages the endothelium, the delicate lining of blood vessels, making them more prone to stiffness and plaque buildup. Foods rich in trans fats. These are found in margarine, fried snacks, baked goods, and many processed desserts. Trans fats raise LDL, the bad cholesterol, and lower HDL, the protective cholesterol. This double hit accelerates plaque formation inside arteries. Over time, these fatty deposits harden, a process called calcification. Calcified plaques make arteries less flexible, and that rigidity keeps blood pressure elevated. Excessive saturated fats from red and processed meats. Bacon, sausages, hot dogs, and fatty cuts of beef or lamb. These are not just high in calories, they're also dense in saturated fats. Clinical studies link high intake of processed meat to higher rates of hypertension and heart disease. The reason is simple. Saturated fat increases LDL cholesterol, and LDL particles easily lodge themselves in artery walls. Once trapped, they trigger inflammation, the very process that turns soft cholesterol into hardened plaque, sugary drinks, and refined carbohydrates. Sodas, energy drinks, sweet teas, and even fruit juices with added sugar cause rapid spikes in blood glucose. This forces the pancreas to release more insulin, and over time, insulin resistance develops. Insulin resistance is a hidden driver of hypertension. It increases sodium retention in the kidneys, stiffens blood vessels, and promotes fat storage around the abdomen. Visceral fat then releases chemicals that worsen inflammation and plaque buildup. Excessive alcohol. A glass of red wine may be harmless, but heavy drinking raises triglycerides, contributes to hypertension, and promotes fatty liver disease. It also weakens the heart muscle over time, leading to a condition called alcoholic cardiomyopathy, which makes blood pressure control even harder. Fast foods and fried foods. A burger with fries or fried chicken may feel satisfying in the moment, but this combo is dangerous. High sodium, trans fats, and refined carbs all collide in one meal. Studies show frequent fast food consumption raises both systolic and diastolic blood pressure, while also increasing LDL cholesterol and lowering HDL. It's the perfect recipe for arterial plaque and calcification. So what's the takeaway? Dangerous foods raise blood pressure in two ways: acutely, by increasing sodium and fluid volume, and chronically, by raising LDL, promoting plaque, and hardening arteries with calcification. If you truly want to protect your circulation, limit processed foods, fried items, red meats, sugary drinks, and excess alcohol. By avoiding these, you give your arteries the chance to stay open, flexible, and resistant to damage. Because when arteries are clear and elastic, blood flows freely, pressure stays controlled, and your risk of heart attack or stroke drops dramatically. Foods that improve circulation and lower blood pressure. Let's talk about food as medicine. Not magic. Not quick fixes, but real, science-backed foods with compounds that directly improve blood flow and reduce blood pressure. Here are some of the most powerful ones and how they work inside your body. Beetroot. Beets are rich in something called dietary nitrates. When you eat them, your body converts these nitrates into nitric oxide. Nitric oxide is like nature's own blood vessel relaxer. It signals your artery walls to widen, to relax, to let blood flow smoothly. With less resistance, blood pressure drops. Clinical trials have shown that beetroot juice can lower systolic pressure by several points, especially in people who already have hypertension. Garlic. Garlic contains a powerful sulfur compound called allicin. When you crush or chop garlic, allicin is released. Inside your body, it helps boost nitric oxide, just like beets. It also reduces stiffness in arteries and lowers oxidative stress. Some studies even suggest it acts a little like an ACE inhibitor, the same class of drugs doctors prescribe to lower blood pressure. Meta-analyses confirm that garlic supplements can reduce both systolic and diastolic pressure, making it one of the most effective natural options. Hibiscus tea. This deep red tea is packed with polyphenols, especially anthocyanins. These compounds have antioxidant effects, but they also block something called the angiotensin-converting enzyme. That's the same enzyme ACE inhibitors target. By blocking it, hibiscus helps blood vessels stay open instead of constricting. Clinical studies show that drinking hibiscus tea daily can lower blood pressure in people with mild to moderate hypertension. Dark chocolate and cocoa. Yes, you heard that right. But only if it's rich in flavonols, the plant compounds found in high-quality cocoa. Flavonols improve endothelial function. In other words, they help the inner lining of your blood vessels release more nitric oxide. That nitric oxide widens arteries, improves circulation, and lowers pressure. The key is moderation and quality. Dark chocolate with high cocoa content, and not overloaded with sugar. Fatty fish like salmon, mackerel, or sardines. They're full of omega-3 fatty acids, EPA and DHA. These compounds reduce inflammation, improve blood vessel function, and may also lower the activity of the sympathetic nervous system, which otherwise keeps pressure high. Clinical research shows regular intake of omega-3s leads to small but meaningful drops in blood pressure, along with overall heart protection, potassium-rich fruits and vegetables. Bananas, spinach, beans, sweet potatoes, all excellent sources. Potassium works in two ways. It helps your kidneys flush out excess sodium, and it relaxes blood vessel walls. This double action lowers both fluid retention and vascular resistance, which directly reduces blood pressure. So, what's the big picture? Each of these foods delivers active compounds: nitrates, allicin, polyphenols, flavonols, omega-3s, and potassium. and all of them point to the same outcome: more nitric oxide, less stiffness, less constriction, better flow. Think of them as natural partners to your heart, not replacements for medical treatment, but allies that make your arteries healthier every single day. Vit K2. Most people know vitamin K for its role in blood clotting, but vitamin K2, a specific form of this vitamin, does something unique. It activates proteins that control where calcium goes in the body. Without enough K2, calcium tends to deposit in the wrong places, like artery walls, leading to stiffness and calcification. When K2 is present, it guides calcium into the right place, the bones and teeth, where it strengthens structure instead of clogging arteries. Several observational studies, like the Rotterdam study, found that people with higher intake of vitamin K2 had lower rates of arterial calcification and heart disease. Another clinical trial showed that supplementation improved arterial flexibility in postmenopausal women. So while K2 is not a direct blood pressure-lowering vitamin, it works indirectly. By preventing calcification, it helps arteries stay elastic. And flexible arteries mean smoother blood flow, lower resistance, and healthier pressure over time. Good food sources of vitamin K2 include fermented foods like natto, certain cheeses, and animal products such as egg yolks and liver. Think of K2 as the traffic controller for calcium, keeping it in your bones and out of your arteries. Lifestyle and diet changes. Here's the truth about hypertension. No single pill, no single food, no single action can fix it overnight. But when lifestyle and diet changes work together, they create powerful results. Results proven again and again in clinical studies. Let's go step by step. The DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's not a fad. It's one of the most researched eating patterns in the world. The focus is simple: more fruits, more vegetables, whole grains, beans, nuts, lean proteins like fish and poultry, and low-fat dairy. At the same time, cut back on sodium, sugary drinks, red meat, and processed foods. In large clinical trials, the DASH diet reduced systolic blood pressure by 5 to 11 points. For some people with stage 1 hypertension, that's enough to bring pressure back to normal. Reduce sodium. Increase potassium. Think of sodium and potassium as two sides of a seesaw. Too much sodium pulls water into your bloodstream, raising pressure. Potassium does the opposite. It helps your kidneys flush out sodium and relaxes artery walls. Foods rich in potassium, bananas, beans, spinach, avocados, and sweet potatoes, bring the balance back. Research shows that increasing potassium while lowering sodium is one of the most effective natural ways to lower blood pressure. Maintain a healthy weight. Excess body weight puts extra strain on the heart. Fat tissue releases inflammatory signals that stiffen arteries. The good news? Even small changes make a difference. Losing just 5 to 10% of body weight can lower blood pressure significantly. That's one of the strongest and most consistent findings in hypertension research. Move your body. Exercise is medicine for your arteries. Brisk walking, cycling, swimming, or even dancing, 30 minutes a day, most days of the week. Clinical reviews show regular aerobic activity lowers systolic blood pressure by about 4 to 9 points. Resistance training adds another small benefit and improves muscle strength. We'll talk more about the best cardiac exercises later, but remember, the human body was built to move, not sit all day. Smoking is even worse. Every puff constricts blood vessels, damages the endothelium, and accelerates hypertension. Quitting smoking is one of the best decisions you can make for both blood pressure and overall heart health. Manage stress. Stress hormones, adrenaline, and cortisol raise heart rate and tighten vessels. Chronic stress means those vessels never relax. Daily practices like slow breathing, meditation, prayer, journaling, or even a quiet walk can lower stress response. Clinical studies confirm that stress management improves blood pressure control, especially when combined with diet and exercise. Protect your sleep. Sleep apnea and poor quality sleep are hidden drivers of hypertension. When you stop breathing at night, oxygen levels fall, stress hormones spike, and blood pressure rises. If you snore loudly or feel tired even after sleep, talk to your doctor about testing. Treating sleep apnea not only improves energy but also lowers blood pressure. So here's the big picture. None of these steps are extreme. They are realistic. They are proven. And together, they give your arteries the best chance to stay open, flexible, and healthy for decades to come. Now comes to the most important way to reduce hypertension: cardiac exercise. This is not just about fitness or weight loss. It is the single most powerful natural therapy for lowering blood pressure and protecting your heart. When people hear cardiac exercise, most think of running or heavy gym workouts. But in reality, cardiac exercise simply means any rhythmic activity that raises your heart rate and keeps it elevated for a sustained time. Walking briskly, cycling, swimming, dancing, or even climbing stairs, these all count. And when done regularly, they transform your heart, your blood vessels, and even your brain chemistry. How exercise lowers blood pressure directly. During aerobic activity, your muscles demand more oxygen. To meet that demand, your blood vessels expand, and your heart pumps harder. Over time, this repeated expansion and relaxation trains your arteries to stay more flexible. Flexible arteries mean lower resistance, and that translates into lower blood pressure. Clinical trials consistently show that moderate aerobic exercise, 30 minutes a day, can reduce systolic blood pressure by 5 to 9 points. That's as powerful as a first-line medication for some people. Circulation improves. Think of your circulatory system as a highway. When traffic flows smoothly, every organ gets the oxygen and nutrients it needs. Exercise stimulates nitric oxide release from the endothelium, the inner lining of blood vessels. Nitric oxide relaxes and widens arteries, improving blood flow. At the same time, exercise strengthens the heart muscle itself. A stronger heart pumps more blood with less effort. So your resting heart rate comes down and pressure inside the vessels eases. Stress levels drop. Here's something fascinating. Exercise changes your brain chemistry. During and after a workout, your brain releases endorphins and endocannabinoids, natural, feel-good chemicals. They calm the stress response, reduce anxiety, and create a sense of well-being. At the same time, regular movement lowers baseline cortisol levels. Cortisol is the stress hormone that keeps your body on high alert and drives blood pressure up when it stays elevated. So in a very real way, cardiac exercise acts like a pressure valve, letting stress out of your system. Exercise reduces cravings for junk foods. This may surprise you, but it's supported by research. Aerobic activity helps regulate hunger hormones, ghrelin, which stimulates appetite, and leptin, which signals fullness. After exercise, ghrelin levels drop and leptin sensitivity improves. This makes you less likely to reach for salty chips or sugary drinks. Also, because exercise boosts dopamine in the brain, it satisfies the same reward circuits that junk food normally triggers. That's why many people find their cravings naturally shrink after adopting regular activity. Exercise burns fat. Hypertension is closely tied to excess visceral fat, the fat around abdominal organs. This type of fat is metabolically active. It releases inflammatory chemicals that stiffen arteries and worsen insulin resistance. Aerobic exercise mobilizes fat stores, especially visceral fat. As you burn it off, the inflammation decreases, arteries relax, and blood pressure drops. This is one reason why even a modest weight loss of 5 to 10 pounds can make a measurable difference. HDL cholesterol rises. We often hear about bad cholesterol, LDL. But HDL, high-density lipoprotein, is the protective one. It acts like a garbage truck picking up cholesterol from artery walls and carrying it back to the liver for disposal. Regular aerobic exercise raises HDL levels by 5 to 10%. That means less plaque buildup, smoother circulation, and reduced cardiovascular risk. The hormonal balance. Exercise reduces adrenaline surges and lowers resting sympathetic nervous activity. That means your fight-or-flight system quiets down. At the same time, it enhances insulin sensitivity, helping your body handle sugar more effectively. All of these hormonal shifts combine to create a healthier environment inside your arteries. So here's the bottom line. Cardiac exercise is not just about burning calories or looking fit. It's a multi-layered therapy. It lowers stress, reduces cravings, improves circulation, burns fat, raises HDL, and trains your arteries to stay flexible. The prescription is simple. At least 150 minutes of moderate-intensity aerobic activity per week. That's just 30 minutes a day, 5 days a week. Add in a little resistance training and the benefits multiply. Your heart, your blood vessels, your brain, even your appetite, they all respond positively. That's why doctors call exercise the single most powerful non-drug therapy for hypertension. You listened. You learned. Now act. High blood pressure is sneaky, but it is not unbeatable. Small changes add up. One swap, one walk. 1 cup of hibiscus or beetroot juice. Those small choices lower pressure. They protect your heart, your brain, and your future. Start simple this week. Measure your blood pressure. Cut 1 processed snack. Take a 20-minute brisk walk 3 times. Try garlic in your cooking or a daily handful of leafy greens. Track the difference in 4 weeks. You might be surprised. If you're on medication, don't stop. Use these steps with your doctor's guidance. Together, medicine plus lifestyle is powerful. If this video helped, hit like. Subscribe for the 4-week plan I promised. Share this with one person who needs it. Comment below, which one change will you try this week? Tell me. I'll make the follow-up video based on your choices. Your arteries want you to move and eat well. Give them that chance. Start today. Small habits, big life. If you found value here, hit like, drop a comment with your thoughts, share this video with someone you care about, and subscribe for more science-based health tips every week.